Welcome to channel Pediatrics and Neonatology. This is a case scenario of pediatric sickle cell disease. Well, a 9-year-old girl with sickle cell disease and hemoglobin SS is brought in by her mother with a complaint of non-productive cough and fever of 38.7 degrees centigrade for 1 day. She is complaining of chest pain that is made worse with coughing and deep inspiration. She has a history of vaso-occlusive pain crisis starting at 18 months of age, typically presenting with upper and lower extremity pain. She has not had other complications associated with sickle cell disease. She has never received transfusion of any blood product. Well, on examination she is quiet but alert with a respiratory rate of 34 breaths per minute. Heart rate 122 beats per minute, blood pressure 112/80, temperature 39 degrees centigrade, and oxygen saturation is 89% on room air. Lung sounds are diminished bilaterally with crackles in both lower lung fields. Now she is given supplemental oxygen, intravenous access is established, and blood for laboratory studies and culture is drawn. She is given a dose of parenteral antibiotics. Now her chest radiograph is shown on the left side. Now the questions are, what is the likely diagnosis in this patient and what complications are related to these conditions? Now the answer. Chest radiograph demonstrate hazy opacities in the upper lung fields. History of fever, tachypnea, hypoxia, and new pulmonary infiltrate on the chest radiograph is consistent with acute chest syndrome in this patient with sickle cell disease. Now, syndrome of acute chest syndrome includes both infectious and non-infectious causes. It has a disease spectrum ranging from mild pneumonia to respiratory distress syndrome and multi-organ failure. Acute chest syndrome is one of the more common reasons for hospitalization, and it is a leading cause of morbidity and mortality. Patient may present initially with vaso-occlusive pain crisis without signs and symptoms until 24 to 72 hours later. Now, most common presenting symptoms are cough, pleuritic chest pain, and shortness of breath. Younger children may present with fever, cough, and wheezing. Clinical signs can precede radiographic findings. Now, answer to the second question. Other considerations and complications of acute chest syndrome include evaluation for pulmonary embolism, fluid overload or overhydration, respiratory depression due to opioid use, and hypoventilation secondary to the pain. The patient was admitted to the hospital, and several hours later she became more short of breath with tachypnea and an increased need for supplemental oxygen. Her second chest radiograph shows increased opacifications. Okay friends, thanks for watching. Please subscribe to my YouTube channel.